Right. Yeah, okay. So if there is any disturbance, please do let me know on the chat box. So I'll be starting my proceedings. So welcome all. So this is Dr. Srikanth from team MDS CONQUER. Okay, I am going to be the lead. Okay, if you're a part of CONQUER, I'm going to be the main lead. So I have finished my graduation in 2012 from St. Joseph Dental College, and followed by I have finished my master's in operative dentistry and endodontics. Okay, and 2018. Okay, so we have started MDS CONQUER in 2015. When I was in MDS first year, we have started MDS CONQUER. A group of friends have started MDS CONQUER. And now you are going to be the 9th batch of MDS CONQUER. You are the 9th batch of MDS CONQUER. Okay, so we have our active clinics, we have our active academies, we have our active online, offline coaching centers for NEET, INI-CET, as well as for other abroad license examinations like INBD, many other license exams, UAE, many other license exams. We are providing the coaching with extraordinary results. So that's a basic introduction of mine. Okay, so first of all, big congratulations to each and every one of you for the people who are done with the final year exams, and for the people whose results are out and they have started the internship. This is the greatest achievement as of now. This is going to be the greatest achievement, and I'm very, very happy for your extraordinary performance at a BDS level. And you are interns now. You have a doctor tag in front of you, but you need to enter into the society with lots of confidence and everything that you will learn through this process. Till this date, as a final year, the game plan is totally different. Okay, so what is the game plan? So I want you to answer this. This is an interactive session. So what is real success and what is real achievement in a final year? For a final year student, what is a real success and what is a real achievement? Pradeep is telling to pass the final year. Come on, I want your answers, because I want you to know what is the reality actually. To clear the final year is a success. To clear the final year is a achievement, or to get a first class 65% above, or to crack a distinction, or to be a college topper or a university topper. Okay, so this is what the basic thing that most of us target for. Okay, right? So okay, we are done with internship. So now, what is the real success and what is the real achievement in an internship? What is a real internship? What you want to achieve? Internship, what is basically success in an internship called as? Clinical exposure, doing more patients, getting exposure to more patients, handling the cases, exposure to more patients, any other gain confidence to handle the patients. Yes, of course, right, Navya? Yes, any other thing you have in your mind? Because the thought process is going to vary from individual to individual. Your thinking may be different, my thinking may be different. So it varies from college to college, it varies from state to state, it varies from people to people. Okay, right. So I agree. So internship is a phase where you need to learn how to handle the patient without any help. Basically, till final year, you have your like co-aspirants helping you, PGs in the department helps you, staff in the department helps you. So different people are going to help you out. But in internship, you're going to come out after internship. So you need to handle the situation by your own, and more clinical exposure. Or if you're reading for entrance, keep a good target. Yes, this is a wonderful. Sharman, you're absolutely right. You should know in internship, you should know which department or which subject you really love, so that you can choose the particular subject in the PG. Having a passion or liking towards a particular subject is different. Because if you can ask me in 2012, 2013, so I'm going to tell what is your favorite subject, what is your favorite department, I'll opt for oral pathology. But that's not a clinical department. So I cannot tell that, because why I have that fantasy towards oral path or oral medicine, two departments, is I love the department staff over there. So that is the reason why I have that fantasy towards the department. But if you come into the reality, So you cannot do, I mean, like they're not clinical subjects basically, right? So, so the ideology, what I have developed, I have my passion develops to a particular department or an internship is more because of the exposure or because I'm knowing the things. Even if you start preparing for entrance examinations or for any sort of examinations, as you go depth-oriented reading, then you will get to know what fantasy or what I mean, like what you really love, what you're really good at, because what you really good at, what you have fantasy, so that's going to make you, and you're going to have passion towards particular things, right? So, right, absolutely right. Wonderful. Your answers, thought process is extraordinary. So what is a real success and what is a real achievement in PG? You have joined PG, prepared well, got a good rank, selected your best department, and what is going to be success in your PG life? So PG lives, again, we have a different goals. Okay, most of you are not PGs. So PG life, we have a different set of goals where we have to achieve, right? You will have, definitely you'll have some goals. Followed by post PG, you may open a clinic or you may work as a lecturer or a reader or something like in a college, or you're going to work under someone, you're going to work under some corporate company, dental offices, you have many other things, and you have a particular role over there, and you have some goals over there in the life. So my perspective is, okay, so what is success, what is a real achievement is always you need to get upgraded. You need to get upgraded from one level to other level. I hope you remember 11th and 12th standard, when once you're preparing for the entrance examination to enter into this MBBS or BDS or something. So you are writing the same exam, after which you are writing BDS first year, after which you are writing BDS second year, third year, fourth year, now jumped into an internship program where you are going to prepare for an entrance or prepare for your goals, followed by every level of life requires an upgrading. So success is something which is not static. It is always dynamic. Okay. Today, my target or my success is to motivate you. Okay. Yesterday, when I was taking a class for your seniors, okay, my target is to make them ready for the exam. Day before yesterday, I was having an interaction with your super seniors for their counseling. I was talking to them. So my target yesterday was different. What is my target? They have to get allocated with the good seats. So in 3 or 4 days or 3 or 4 weeks, I have a different thought process of success. So success is not static. It's going to vary. It's going to be dynamic. So dentistry requires a dynamic success at different levels, success in different areas, success in different directions. And do you accept this or not? Do you accept this? Success is not static. It varies from individual to individual. It varies from time to time. It varies from place to place. It varies everywhere, right? So do you agree, right? Yes, absolutely true. The best example I can give you is, what is the best mobile as of now available in the entire world? What is the best mobile as of now available in the entire world? Best mobile. Or else you can give a tag, best mobile company. What is the best mobile company? Yes, absolutely right. Absolutely right, everyone. Sakshi, right, you're right. And this is what the example is. iPhone, every year they're going to launch a new series. Why they want to launch a new series? Because they want to get upgraded. This is the best mobile as of now available in the market, best mobile company with crores of revenue generation. But every year they come out with a new thing, they launch a new thing, they upgrade themselves. So life requires upgrading. Dentistry requires upgrading. Everything requires upgrading. Whether you're a dentist or whether you want to go out of the field, it's okay, but you require upgrading. A simple exam I can tell you. Okay, so probably in 2012, 2013, when I was an intern or when I was a final year student, so the most common restorative material that we do in our department is what? Can you guess what is the most common restoration that we do in the departments? 2012, 10 years back, most common restoration. Yes, absolutely right. Amalgam. Everywhere amalgam. Now 2020 to 2023, what is the most common restorative material that is being done? Now, what is the most common restoration that they are doing? Now we are telling composite. Pradeep is telling composite. Lakshmi is telling composite. Right now every one of us are doing composite. Okay, maybe, right? So maybe probably 10 years from now, 2032, 33. Okay, 2032, 33, maybe you will be at a different level in dentistry. Composite may get replaced by some extraordinary material too. There are chances. There are chances. Okay, it can be replaced by an extraordinary material. So what is happening here? We are upgrading. We are upgrading the dental knowledge. We are upgrading the dental practice. We are upgrading everything, right? So life always requires upgrading. So my question for you, interns, the upcoming dentists, the upcoming future of the dentistry, probably, I told you, right? So 10 years from now, 2032 to 2033, 10 years from now, you're an intern now. After 10 years as an intern, so you're going to be the future. You're going to be the star. You're going to be the staff. You're going to open clinics. You're going to work clinics. You're going to operate the patients. And most of the dentistry will be run by you probably within the next 5 to 10 years. So the future of dentistry. So I'm asking how you are planning to upgrade yourself. How you are planning to upgrade yourself. How you are planning to motivate yourself. Okay. So this session is mainly on that upgrading. What to be done to upgrade yourself? What is going around you? What is going to be your future? So this is what I'm going to talk about. Are you ready? I want you to be active. Okay, 70, now it is 72 or 75 plus. Okay, right? A decent figure to my expectations, right? Chalo, we'll start. So most of the Indian dentists, what I see, like probably this is the 9th batch of MDS CONQUER, and I have trained around like 12,000 to 13,000 dentists, particularly, and these 12,000 to 30,000, more than 60 to 70% are interns. Okay, so I know the mindset of interns because I talk with interns every day. I interact with interns every day. I talk with the interns online, offline, everywhere I move. I came to Bhopal. I came to many other places. Now I'm planning to come visit NASIC. Okay, because I need to meet your seniors. Probably once, probably in November, I'm planning to come to NASIC and many other places in Maharashtra also, because I love to interact. I should know what is happening with you, then only I can find a solution to help you out. Okay, so the problem here with most of us are, so whenever you see, yes, I'm upgrading, but it never goes full, it never goes 100%. It is always upgrading. Okay, so there will be always breaks, some struggles, and everything happens. So I'm going to tell you what are the mistakes that an intern should not do to be successful. Everyone, you can open YouTube and you can see so many videos. Everyone are uploading videos. That's a different story. So everyone will tell you how to be successful, but I'm going to tell what things you should not do so that you can be successful. There are few things that you should never do. Okay, you should never do in your entire life of dentistry or in your entire life as a professional with a professional tag. You should never do such things. I'm going to tell you. So my first question for all of you, how are you feeling about dentistry? Now, as an intern, how are you feeling about dentistry? I have given different types of smileys. Okay. Okay. So what do you feel about dentistry as of now? Okay. What you are feeling about dentistry before the session? Okay. Yes. Very nice. Excited and proud. Yes. Extraordinary. These are the extraordinary things I'm able to see for the first time. Excited. Yes, of course, you should be confused. You should be confused. Okay, you should be confused. Confused is something very common. Okay, right. So dentistry is something like which is very, very vast. Okay, so first of all, you should know what you are good at. You should know what you want to do. You should know what is going to make you happy. Okay, so before that, my kind suggestion for all of you. Okay, so whatever you are, okay, wherever you are, whatever profession you are going to do, so don't insult your profession, because your respect belongs to your profession. What you are is your respect. If you give respect to your profession, then people will automatically respect you. But if you insult your profession in front of others, then don't expect respect in response. So this is what I want to start with. I have been seeing so many of my friends, so many of my students, so many of my juniors. Okay. So first of all, I don't know why they insult our profession. I don't want anyone to insult our profession. Okay. So now you are a dentist. Now you are a dentist. You may die as a dentist. So dentistry is the greatest divine thing for you. Do you accept this or not? You have to feel proud that you are a dentist because it's our profession. I'm not comparing with any other profession. Why? The best example, I was traveling long back, like 2 years or 3 years back in an auto. An auto wala. An auto wala is very proud about his profession. Okay. In the auto, he has kept some beautiful lights. He has kept some beautiful songs. He has kept some beautiful flowers. Okay. And he is making, or he's taking care of his auto in a very most and a decent hygienic way. When an auto wala is taking his auto in such a care, and how you have to take care of your profession called as dentistry. Am I audible, right, guys? Am I audible to you? Yes, right. So first of all, I want every one of you, stay strong, give respect to the profession. So once you start respecting your profession, automatically it reciprocates well. What is dentistry now in India is what the dentists have done. I'm not going to talk whether it is a good or bad. How the dentistry is there in India is what we have done. How a profession is there is what they have done. Okay. So this is better, that is bad, this is good, and everything is just a comparison. So I'm not here to compare, because if I start comparing, so there's no point. Okay. Your life is very unique. You are very unique as an individual. No one can copy paste you. No one can resemble you. So there is no point. Okay. Virat Kohli and I born in the same week, in the same year, in the same month. Okay. There's no point of comparing me with Virat Kohli, because I am unique to myself and I love myself more. So I don't want to compare with any other individual. Comparison is nonsense. Okay. But giving respect to what you're doing is the most important thing that any individual can do. And this I have seen in auto wala, that I have seen in a rickshaw wala, I have seen in someone who is selling, who's a vegetable vendor. They're very respectful there to their professions for what they're doing for their family or for themselves. Why can't a dentist? So the first quality that an intern has to develop is you have to feel proud of your profession. You have to respect your profession, and you have to find the best way to sort out something better in your profession, so that once you're doing better in dentistry, you grow and dentistry will grow. If for example, like this year, some 2000, you have a bulk of dentists who are coming out into the market. Okay. Some 50,000 dentists are coming into the market. If all 50,000 dentists are doing extraordinary dentistry, how the dentistry will be in the next 5 years? So dentistry will get upgraded. So dentistry is far better in many other developed countries. You take USA, dentistry is utmost respectable profession. You take UK, dentistry is so respectable profession. You take Australia, you take New Zealand, you take many other countries where dentistry is really doing extraordinary. Why? The dentists are doing extraordinary. The dentists are doing extraordinary, so it become an extraordinary dentistry. But if you talk about India, only 10 to 15% of dentists are doing extraordinary. I'm not blaming the entire dentistry. I am monitoring the dentistry. I'm talking with the dentists. I'm interacting with the dentist, so I can see 10 to 15% of dentists, not all the dentists, 10 to 15% of dentists are doing really extraordinary dentistry similar to other developed countries. So what I can tell you is dentistry is not developed in India. No, that's a wrong statement. Dentistry is developed in India, but it is developed to a certain extent, only to a certain places, only to a certain clinics, only to a certain dentist. I hope my wordings and my talk is very clear, right? So I hope you got what I mean. So I have been interacting with so many big people. They simply say dentistry is not developed in India. It is developed in US. No, it is developed, but it is limited to a particular places. It is limited to a particular people. It's limited to a particular zone. That's what I mean. Okay. So you need to find out how to make it move to the next level. How a dentistry can move to the next level is the dentists, they have to do something. Only when dentists started doing something, dentistry will do next level, right? So do you agree for this statement or not? Interns, you are going to be the next 5 years, you will finish your PGs, you're going to come into the market, and you are going to be the future. So that is the reason why. So you need to push yourself from the day one so that you can reach these big goals in the future. If you're clear with what I have discussed till the point, I'll be moving to the next very, very utmost important topic of today. Okay, chalo. So what are the biggest thing, what I have learned is I have learned from my mistakes. Okay, so are you ready to hear my story as an intern, how my internship has started? Because I have learned so many things. Okay, because I have wasted, basically I have wasted so much of my time. 2-3 years I have wasted. So I have learned so many things. So I'm going to share my story. So it's going to be a bit funny. Okay, so please do enjoy my story. Okay, it has so many twists like your Bahubali part 1 and part 2. I hope you have seen Bahubali, right? So you have seen Bahubali, you have seen KGF. Okay, I have seen many movies with lots of twists. So my story is filled with lots of twists. So first of all, my story is a very, very cool story. I'm a good student at a UG level. So BDS level, I'm an extraordinary student among my batch. So I read, get good scores. I got a distinction in the final year too. So the results were out. So the final year result, similarly, the final year result was out. I got a distinction. Okay. So then what I have done, my goals are very, very simple. I have started my PG preparation. So I have started my PG preparation. I started my PG prep. So I was interacted with my seniors and my super seniors who got good ranks, who settled well. So I started my PG preparation. Like similarly, most of you have already joined and started the proceedings. So I have started my PG preparation. So once you are preparing in the college, probably in the library, probably in the department, what is going to happen? So in the next few days, 1 month or 2 months, so this is going to happen for you. Okay. So everyone keep their eye on you. Everyone is going to see you. Once someone is doing good, they'll keep an eye on you. Okay. So your juniors, seniors, PGs, teachers keep an eye on you. So monitoring will be more. So everyone are going to monitor you. So many eyes on you. So people, once they have eyes, what they do? They give suggestions. So I got so many suggestions. Now, basically, I have started with a plan A, that is my PG preparation. Okay. But as many people are seeing that I'm reading, I'm working hard, I'm sitting dedicatedly. So what I have got my plan B, I have got my plan C. I got so many plans. Okay. So I was confused. Okay. I was confused. Okay. So one of my senior told, okay, why can't you join a clinic? Why can't you join a clinic? So then I got a call letter from one of the clinic. I went for there, went for an interview. So I got selected in the interview. So then I quitted my preparation, quitted my prep, and I have started the clinical work. I have worked under clinic. So why I have quitted my preparation? I don't have answer till my senior told I quitted. Why I have started my preparation? My senior told I have started. Why I have joined a clinic? My senior told I have joined. Do you agree for this? This is what happened with me. So as I am going clinic, okay, so it's almost like 2 to 3 months done. 2 to 3 months are over. So then I met so many staff over there who settled at a very high level. So then one of my staff told, Shrikant, guy, dude, you're extraordinary. You're extraordinary. Your knowledge is extraordinary. You're hardworking. You're smart. Okay. So such candidate has to move to USA, not in India. So he has motivated, one teacher of mine who used to work in the clinic has motivated me to go to USA. So now my plans again has changed. Confusion. Plan A, plan B, plan C. So finally I opened the Google and I was searching about dentistry. So I got so many beautiful photographs related to the USA. So I thought of going for USA. So first I started preparation for NEET. Then I pushed myself to a clinic where I have worked for 6 to 8 months. Then I got motivated for the plan of USA. So I have cleared GRE, I have cleared TOEFL, I got an admission. Okay. So what happened? After 3 months, I got a clarity before, like probably within 3 months, I'm flying off. I got a clarity that, okay, my financial situations were not clear, not great to support the US demands. Okay. Because I have never done a groundwork by myself. I was just following my senior. First of all, I followed my senior. My senior told to prepare for PG. Then there is one more senior came into the ground. He told me to join a clinic. Then a clinician who is a teacher of mine has suggested me to go to USA. I have never done a groundwork. So now all these are gone, USA and everything. So finally, I was sitting with my teacher and I was started asking. So he asked me, how many clinics are there in your hometown? He asked me a simple question. How many clinics are there in your hometown? I said only one clinic, sir. Then he told me to open a clinic in my hometown. Your clinical work is decent enough. You can open a clinic in your hometown. So then again, my plans has changed. Confusion. So most of us have started the session like how you are feeling about dentistry. Yes, most of you have answered confusion. So I am in a state of confusion. So again, my plan A, plan B, plan C has changed. So finally, I went to the home. I was sitting with my father. I was talking with my father. I told my father that I need some 2 to 3 lakhs so I can open a clinic, because we have a good commercial space in our hometown. Okay, so I can open a clinic in my commercial space itself. So this is all the positive things what I have discussed with my teacher and I have implemented in the home. So after a few days, my father has called me up and told me, Shrikant, I cannot adjust 2 to 3 lakhs as of now. My father said, no, I can't. If you want, you can take the commercial space, but 2 to 3 lakhs for a small single chair clinic is not going to be possible, my son. I'm sorry for that. So this was after 2 to 3 months of discussion with my father. So now again, my plans has changed. A, B, C. Right. So I was so depressed, so disappointed where I have started my preparation. Then I joined a clinic. Then I thought of going for USA and wasted 6 months. Then I came back to the home and wasted for 2 to 3 months to open a clinic, finding the places, finding the things and everything. Can you guess what happened next? Bahubali. Why Kattappa has killed Bahubali? Why Kattappa has killed Bahubali? Any guesses what has happened next? Pradeep, guessing a routine story. Anyone, guys? So what happened is, this happened. What is this? What is this? No, it's not my marriage. Not my marriage, Pradeep. My girlfriend got married. Okay, so my girlfriend got married. So, of course, once your girlfriend is got married, so what is going to happen? You will go to utmost depression. You will lose everything in the life. Yeah. So again, plans has changed. A, B, C, D, everything. So what I have done, I took a break for 6 months. I rebooted myself and I have restarted the preparation again. So my story is very simple. My story is very, very simple. I started my preparation. With the suggestions, I have quitted the preparation and joined a clinic. With the suggestions, I have planned to go for a USA. With the suggestions, I have planned to go and open a clinic. Then things were completely out of my hand. So I have restarted the preparation. So what preparation has given me? So this is what basically I have planned. I have planned a single chair clinic in my hometown, but the twists in my life, okay, the confusions in my life, the learning process in my life, the struggle in my life, after 6 years of hard work, God planned something big for me. I opened centers, trained students with my experience and skills, and I have opened a clinic. I thought of opening a clinic in my hometown, which is probably a single chair clinic. Okay, but luckily, now I have opened the largest microscopic clinic in the country. We have 5 microscopes with 6 chairs, which is the largest microscopic clinic in the entire country. Okay. So, I mean, we have an academy. Okay. We have an academy, microscopic academy in the city of Hyderabad. Okay. And we are doing very, very good. So it's just a matter of 6 years. 6 years. It's just a matter of 6 years. Everything has changed. I thought of opening a clinic in my hometown. Now I have opened a biggest clinic in Hyderabad. So it's just a process of updating yourself. It's just a process of learning from your odds, learning from your difficulties. Okay, planning, interacting with the people, understanding what is happening in the society and reacting according to the requirement of the society. So there is no point, like if you're selling something woolen clothes in a summer season, doesn't make any sense. Okay, so everything requirement has a particular phase, a particular time, what the society requires, what really the dentistry requires. So if your thought process is going in such a way, for example, what the crowd requires, okay, so you need to go and answer, or you need to go and address such things so that you can grow high in your profession. That can be like, so for example, you're from operative dentist in endo, everyone are doing root canal therapy. What you can do special in this? Can you handle the curved canals? Can you retrieve the files? Are you best at re-root canal? Are you best at periapical surgeries? Are you good at smile designing? Are you good in handling the patient? Are you good in converting the patient? Are you good in talking with the patient? So these are things which are done by very few dentists. Okay. So what I feel strongly is find your strong point, work on it, enhance yourself, polish yourself, learn. Dentistry is not a day or it's not an year. It's a process. It's a process. Like what I am as an intern in 2012, 2013, and what I am now in 2022, 2023 is totally different. I have learned so many things because I am interacting with the people around me. Okay, finally, welcome to MDS CONQUER. Okay, so MDS CONQUER Academy, MDS CONQUER Hospitals, and MDS CONQUER Training Center for your NEET, INI-CET, INBD, and everything. Okay, so most of you are in a confusion. What after BDS? How many of you are in this state of confusion? What to be done? Or you have already decided whether you want to start the prep or you want to do MDS. There are a few people who have already decided that you want to start your prep. But how many of you are still in the state of confusion? I want your response on the chat box. Anyone still in the state of confusion? Okay, so this is the perfect answer for you. First of all, I want every one of you to prepare the goal. What you want to be, what you want to be, what you want to be in the dentistry. You should have an answer. I'm not forcing you to decide your department now. I'm not forcing you to decide your plan now, but I want you to decide what you want to be. What you want to be. And after deciding what you want to be in the dentistry, what you want to be in the next 5 years, decide a proper plan. Prepare a plan for that. Sit, talk with the people who are good at this, having good knowledge about this, who talk positive about dentistry. Don't sit and talk with someone who has vast knowledge about dentistry, but not positive, because you require a positive vibes at this particular phase. You require a positive vibes. You require a strong positive vibe. So people who are positive towards the dentistry, people who has good knowledge over the dentistry, people who has good knowledge in counseling you, sit with them, prepare a proper goal, prepare a proper plan. This is the most important thing that you have to do if you want to be successful, because that is the biggest mistake I have done, so that I have wasted 2 to 3 years of my valuable time. Because I take suggestions, random suggestions from everyone, and I keep on moving in my life. This is what the biggest mistake I have done. So I don't want any one of you to do the same mistake. If you require, we are open to help you out. We are open to counsel you. We are going to check your financial levels. We are going to check your mindset. We are going to help you out. And we are going to tell you what suits best for you by telling positives and negatives of each and every step. And so that accordingly you can plan your goal, and goal with a proper plan and with a proper mentor is must. So my goal for all of you is, have you seen this Good Doctor? The Good Doctor web series available on Netflix in different. Have you seen this at least one episode? Have you heard this at least? Right? Okay, so I want every one of you to become a good dentist. Everyone can become a dentist. All 100 of your batchmates one or other day are going to become a dentist. So every one of us are dentists. Okay, but I want a good dentist. In fact, I want a great dentist. I want a great dentist. So keep your target to become a good or a great dentist. I don't want everyone a dentist, right? So I want a good dentist or a great dentist. Market requires good and great dentists. Dentistry requires good and great dentists. If you want to develop dentistry to the level of USA, to the level of UK, to the level of other countries. We require good dentists. We don't require dentists. Dentists are so many. The dentistry is saturated. Dentistry is saturated. Agree. Good dentistry is not saturated. Do you agree for this or not? Good dentistry is not saturated. I have many of my friends who has a bad dental experience till the date. Means we don't have good dentists. That's what they're telling. Dentistry is not good because I have a bad experience. My mother has a bad experience. It's not about a pain. It's about the failure of the treatment. So we don't have good dentists here. We don't have very good dentists here. Okay. We don't have a great dentist here. We are having dentists. So I want every one of you to become a good dentist. Your target should be a good dentist or a great dentist, not a dentist. Again, you're done with your final year exam results. You're a dentist now. But now a dentist has to convert into a good, followed by a dentist has to convert into great. So then you will have your weightage in the market. Then you will have your demand in the market. You got what I mean? Are you clear about what I'm talking? Difference between normal dentistry, difference between a good dentistry, difference between extraordinary and a great dentistry. So plan to shift from this level to that level, that level to that level. This is how it should be. Don't stuck yourself at a one point, taking your family responsibility. I have seen many of my students taking family responsibilities, not getting upgraded. They're doing whatever they want. They're doing whatever they want. They're doing whatever they know. They don't upgrade. Why? Sir, I'm married. I have kids. I have responsibilities. I have EMIs. I have this. I have that. My father, my mother, health issues and everything. This is personal. Whatever the terminologies which I have used is personal. And whatever I'm talking about dentistry is professional. So don't include your personal life into your professional life, not now after 5 years. Now you have completely, the personal life is totally different. You go out, enjoy, move out, do everything, whatever you want in internship. But this is not going to happen after 5 years. So don't mix your professional life to personal life. Whenever you mix your professional life to personal life, both struggle. Clear? Clear? So I want some extraordinary dentists. I want some good dentists. I want some great dentists to come out in the next few years. And I want every one of you who are going to hear this session, maybe live now or maybe streaming on the YouTube. I want you to focus on to become extraordinary in the dentistry. That's my kind request, because if you become extraordinary, overall the dentistry is going to be extraordinary in India. I want dentistry to be best, to get upgraded in the India in the upcoming years, maybe 5 or 10 years. And the complete responsibility is dependent on the young dentists who are in the market. So to do this, what should I do? What should I do? Sir, I want to become a good dentist. I want to become an extraordinary great dentist. But what should I do, sir? You have to follow this principle. Okay. So this is trust principle. Means you should trust first of all. Good dentist. Who is good dentist? I am good dentist. So first, if you are good dentist, you have to trust that you are good dentist. I am great dentist, sir. So first you have to trust it. So trust depends upon few important things. One is consistency and second one is time. Consistency means you should struggle. You should work every day to become good or great. And second thing, you have to do everything in as less time as possible. Sir, I want to crack the entrance. How many years? After 10 years, you want to crack? Sir, I want to finish the BDS. How many? 5 years. Sir, I want to finish the BDS in 5 years, sir, with good knowledge and everything. So whatever you do, we always talk about time. Do you accept it? The most important thing for us is time. How many of you agree for this? How many have you seen Money Heist? How many of you have seen Money Heist web series? Very, very, very trend-setting web series in the case of your COVID-19. How many have you seen here? Yes, right. Sakshi has seen. Right. So what is the most important thing in Money Heist web series? What is the goal? What is the primary goal of Professor in the Money Heist web series? What is the primary goal of the Professor in Money Heist web series? kite. I'll give you the options. So what is the major goal of Money Heist web series? Option A, stealing money. Option B, stealing time. Is it stealing money or stealing time? Yes, Money Heist web series run on stealing the time because there is no money there to steal. Okay, there is no money there to steal. They have to print the money. So when they have more time, they can print more money and they can steal more money. So the concept of Money Heist web series runs on stealing the time. The more the time you steal, the more the money you can print, the more money you can steal. Okay, so life also moves on time. Okay, so you have to do everything in as less time as possible. So it's inversely proportional to the time. So if you follow this principle throughout your life, everything is going to change around you. You know this, guys, occurs long back. What is this? At least, if not girls, I want guys to answer this. What is this? So most of us will miss things by a margin. Probably, I hope like at least few of you have missed your MBBS seat by a margin. Am I right? I have missed MBBS seat by a margin, maybe margin of 5 marks. I hope most of you have missed your MBBS seat by a margin and you have taken BDS, right? So similarly, what has happened in recent World Cup is, so Dhoni has missed the World Cup, this World Cup semi-finals by a margin. So you can tell me, sir, all these are by luck, sir, anything. So what happens between the England and New Zealand in the final is, England-New Zealand final was draw. It's a draw. So whenever there is a draw, what they do, they keep a super over. What happened? Super over is also draw. And they have, New Zealand has missed the World Cup, the first World Cup for them. New Zealand has, recently they got the Test World Cup, but New Zealand has missed the first World Cup by a margin. After getting into finals, the final is a draw. After playing the super over after a draw, the super over is also a draw, and they have missed the World Cup by this margin. So in our life, most of the things, costliest things, expensive things, life-changing things, we are going to miss by a margin. So I don't want anyone to miss anything by a margin. So I want everyone to take calls seriously. There may be 1 or 2 individuals. I still remember there is one of my batchmate who has missed distinction in the final year by 1 mark. Very painful it is. Maybe now she may be fine. Now she may be fine with that, but she cried like anything. She has missed distinction just by 1 mark. Maybe most of you have missed your first class by a mark, maybe 70% by a mark, or distinction in a particular subject by a mark, if I'm not wrong, right? So I want every one of you to be serious before missing anything by a margin. So first and foremost thing that any one of you has to decide is about my trust principle. Okay, trust is directly proportional to consistency and inversely proportional to time. And followed by, if you want to settle as a dentist, if you open Google, if you open here and there and you see lots of things, I don't consider MPH as a dentistry. Hospital administration is not dentistry. Is it clear, guys? There may be few of your seniors, super seniors, or someone XYZ, they do MPH going to USA, they do MPH in India, they do MBA, they do something XYZ. That is not dentistry, yaar. Those are considered as options after dentistry. They are not only options after dentistry, they are options after MBBS also. There are options after biotechnology also. There are options after B pharmacy also. There are options after Ayurveda. There are options after homeopathy. Is it clear? If you want to stay in dentistry, those are different. If you do MBA, hospital administration, you are no way called as dentist. You will have your dental degree, but you are not a dentist anymore. Or if you are doing MPH, public health, you are not dentist. You have degree, you know knowledge, but you are not dentist. So dentistry is something you stay in dentist. You behave as a dentist. You treat as a dentist. Okay. So first of all, you have to decide whether you want to go to whether you want to go to abroad, whether you want to stay in India. The first foremost important thing. Two options you have: staying as a dentist in India or staying as a dentist in other countries. So here there are many dentists who are taking multiple ways, MPH, MBA. There are many other things that the people are doing. There is one of my friend who has done fashion designing also. Okay, so you have many options to be done if you are going abroad, or even in India also there are many other gateways you can move away. If you are planning to move away from dentistry, that is also fine. But I'll be talking more about the things which you have to do as a dentist. So internationally, if you are going, okay, what are the other ways you can practice dentistry in other countries, or you can learn something in internationally and come back in India and practice. Okay, is it clear? I want everyone to be active from now, because this is going to be more informative. Until now, I tried my best to motivate you, tried my best to guide you, to know your mistakes. And I highlighted my mistakes, what I have done during my internship and post-internship. So now I want you to be active, because this is more of an orientation related stuff. So if you are planning to go for international, the most important thing that you have to consider internationally are three important things according to me. Three important things has to be considered. The first and foremost important thing is, what is this? Yes, right. Time. The second most important thing that you have to consider is money. Means how much time is going to take for you to settle down. Second one, how much money you are going to spend by the time you start making money. And what is the third important thing? Third factor. Anyone can guess me what is the third factor? Third important factor for your international plan is? Any guesses? Who is the most important person for your international plan apart from you? Apart from you? Yes, the third important factor is parents. Why parents, sir? Who will provide you time? Parents has to provide you time. Who is going to provide you money? Parents has to provide you the money, because you don't have money. I don't have money when I was an intern. So parents has to provide. So these are the three important factors which you have to consider. So if you are planning international goals, sit with your parent. Tell that, okay, dad, mom, I'm going to take this much of time, maybe 5 years from now, or in this 5 years, I'm going to spend this much amount of money, and you need to sponsor the money. You need to arrange the money. So everything you have to discuss with your parents. You should know, first of all, what are the proceedings, what is the time, how much time it's going to take, what are the exams to be cleared, how much money you need to spend, and followed by you need to discuss the same with your parents and take the permission. Because I have seen many such conditions where the students were well prepared and planned. They have good plan. Students have their plan. And of course, parents will also have their plans. Okay. Student prepared well and arranged everything. Finally, father told, I have a different plan. I'm thinking of you to get married in the next three years maximum. I cannot give 5 or 6 years for you to go to USA or do something and come back. So my suggestion is, rather than your plans to be going in waste. Okay, that's what happened with me, because I thought my father was financially very strong when I was planning to USA, because my father never said no for how much I'm going to ask at a UG level. And logically, that's a misconcept I have, because I never used to ask more than 5,000 or 10,000. So whenever I ask 5,000 or 10,000, my father used to immediately deposit on my account during my UG level. But once I asked my father 30 lakhs, he said, no, he doesn't have 30 lakhs. I don't know the financial situation of the family at that time. So my suggestion for all of you, when you are planning abroad, make sure you sit with a good mentor, you discuss about the things, checklists and everything. Then you discuss the same with your parents, take the permission from the parents, then start the proceedings, or else you're going to waste the time. Is it clear? The most important things for USA or UK or any country abroad plans is, first is time, second is money, third one is the proper permission and support from your parents. You can do by your own, Probably without your support from the parents, maybe after 10 years from now, after making money. For example, at that situation, I was not in a position to go to USA because of my financial situations. But now I'm financially strong. If I want, I can go. I no need to ask my parent, or I no need to ask anyone, because now I'm financially stable. I'm financially fine. Is it clear? Clear? Time, money, and proper support from the parents. And of course, before talking about the time, money, and everything, you should have a proper mentor. You should have a proper resource person who has vast knowledge on these things to take a proper call. Without guidance, by trusting the Google or by trusting some XYZ stuff, if you take a call, you are going to waste your time like me. Proper guidance, proper resource person is very, 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 very important. Clear? Can I move to the next part? So for every call, what you are going to take, whether it is dentistry, I'm talking about dentistry, whether it is dentistry or what you are going to take, the steps and everything, you should be very, very clear. For example, you are planning to become a dentist in USA in the next 5 years. So you should know everything about INBD, and you should know everything about the amount that you are going to spend, the exams that you are going to take over there, or the steps that you need to go through. Or if you are planning to go to UK, what are the procedures? How it is? What is the waiting time? How much amount you need to spend? Am I capable of handling this or not? Or you are planning to Canada for a license exam, or you are planning to go for any other UAE country. So you should know. Okay, long back UAE people, they used to take BDS, but now they're not taking BDS people. Now everything moves on MDS. So MDS plus 2 years experience is required to go to UAE. To go to any countries like UAE, Dubai, Qatar, Saudi, any other countries, options are very good and open, but you require 2 to 3 years experience after MDS nowadays. Long back, we require a BDS with 3 years experience. Now they have changed that. Okay, so now they have changed. MDS with 3 years experience is required for an open job in the case of your UAE countries. Similarly, there are many other countries. You have Australia, you have New Zealand, you have many other countries, Singapore, Malaysia. There are few of my friends working in Malaysia as a dentist. There are few of my friends working in Singapore. There are few of my friends have settled in USA. There are 2 juniors of mine are in UK. And there are many of my seniors, co-aspirant students who are working in UAE. Many other things are happening, right? Okay. So for any call, first of all, you check out the positive side. You check out the positive side, and similarly you try to check out the negative side also. Okay, any call, okay, try to focus on negatives as well as positives, and consider yourself in the situation and take a proper call. That is very important. That is the reason why we always have to sit with a proper individual research person who has to take the proper information. Then you have to take a call, because most of these calls are irreversible. If you take a wrong call, you have to suffer a lot. So you have to be very, very careful in taking the calls. Right. So finally, okay, so most of us, after digging out and everything, so most of us, they ask this question, sir, is MDS the only leftover option or the best option among the rest? Okay, so what I strongly believe is, yes, both can be right, or I suggest like MDS is going to be the best among the rest of the options. And like, how many of you traveled on a ship or on a boat ride, or a ship ride, or an airplane? How many of you have traveled on these things? Ship, boat ride at least? Have you traveled of any of this? Yes. So when you travel any of this, what we are going to do, we are going to have something like a life jacket. Okay, we're going to have life jacket. Okay, so but the probability of using this, we never use this. Okay, if we have, I mean, I have never used, I have traveled in so many flights, I have never used this. Okay, if a situation comes where I have to use this, I may not be there. Okay, so MDS is something like a life jacket, okay, which should be there with you. When it's going to support you, it's going to save your life. Okay, when it is sinking. So MDS is again going to give you the maturity. Dentistry requires maturity. That's simply that most of us call it as experience. Experience not in terms of the years, experience in terms of the number of cases you do, number of patients you do, number of patients you interact. number of different range of cases you do. And MDS is something like apart from getting a degree, you will get lots of knowledge and experience and maturity towards the dentistry. So I'm going to ask you a simple question, a normal question for you. So what you do in perio department, UG level? Perio department, UG is what they do. Scaling. Scaling. Anything apart from scaling? Navya is telling hand scaling. Do you do a hand scaling in a clinic? You do hand scaling in a clinic? No. So what you do in a clinic is totally different. Okay, what perio PGs you have seen, what they're doing in the clinics? Perio PGs. Of course, they do scaling. Scaling is common, right? Okay, they do flap surgeries. Flaps. Apart from that, you have seen anything apart from flap, scaling, anything perio people? Okay, they do implants. Augmentations. Okay, many other things like. And normally in a metropolitan city, what we do mostly in a clinic in a perio is, of course, scaling everyone can do. I'm not going to talk much about scaling. Okay, we'll be doing laser flaps, laser blaze flaps. Okay, so what my point is, what you do at a UG level in a perio department is not we practice in the clinic. So there is so much that you have to learn in a department like perio to come out and have a bright practice. To come out and have a bright practice, right? So, for example, I'll talk about other departments. So, what you do in oral surgery, UG level? UG level, what you do in oral surgery? Extractions. Anyone of you have tried impaction at least? Extractions, right? Okay, extractions. Impaction at least. Suture removal. What PGs will do in your college? Disimpaction, right? Trauma cases. Surgeries. Orthodontic. Cleft lip, cleft palate. So there are many other things which we are not learning at a UG level, because UG level surgery posting is how many days? 1 month. 1 month in final year, 1 month in internship. Perio posting, 1 month in final year, 1 month in internship. Are you going to learn within 2 months everything? Are you going to learn everything, every of these in 2 months? Not possible. This is why PG is required. This is why PG is required. Do you know how much a metropolitan city laser flap they're going to charge? Just, I mean, how much scaling you're going to charge in your college? 100 rupees, 50 rupees? Scaling, how much you charge in the college? 200? 200, I think it's a maximum. 100 or 200 maximum. Just imagine how much you are going to charge a flap in a metropolitan city like Hyderabad, Mumbai, Bangalore, Chennai. 30,000 to 50,000 they're going to charge. Do you really believe that with the UG knowledge, can you do a flap surgery? Can you do a laser-based flap and make 30,000 to 50,000? No, but you can make it. You can make it over a period of experience. If you know the maturity, I was talking about the maturity. I was talking about the experience in the dentistry. You're going to make it. Can an intern, a final year student who has posted 2 months in an oral surgery department, can he do an orthodontic surgery? Can he do a cleft lip and cleft palate surgery? Can he properly do an impaction? That's my question. Then can he properly do an impaction with just two months experience in the department? In that 2 months, again, you will have 8 Saturdays and 8 Sundays. 8 Saturdays and 8 Sundays will be there. No, right? So that is why PG is required. That is why PG in a good college is required. That is why PG in a good department is required. That is why PG in a college with a good OP is required. Do you know what is the real necessary or essential thing why you have to do a post-graduation? So dentistry require good dentist, experienced dentist, maturity dentist. So you have to gain that maturity from a PG, from a good college with a good department and a good OP. Of course, good infrastructure and material should be there, right? Right, you got that. Is I don't want to discuss much about this. Okay, so every department, like you ortho, what you do at a UG level? Ortho. Now it's ruling part of dentistry, trending part of dentistry. Case taking. Pradeep is telling case taking. What you do on ortho? Preclinical work. Oh, do you do the preclinical work in the patient? Now everyone are going for Invisaligns, everyone are going for aligners, right? Everyone are going for aligners, invisible braces and everything. Where you are going to learn at a UG level, what you learn in ortho is a nonsense. It's just a basement, because they cannot teach everything in 2 months posting. Simple logic, sir. Why they can teach everything, sir, right? So they cannot teach everything in a 2 months posting. Okay, so they have the limitations of time. So within the limitations of time, you are able to learn the basics and you are able to come out. So that is why a PG is required from a good college, or experience is required, or a maturity is required by exposure to vast number of patients and vast number of cases. Clear what I mean? I hope you're clear. Can I move ahead? Okay, to the next part. So now PG, okay, how can we do MDS? Okay, so there are many ways of doing MDS. So now I'll be talking about MDS in India. So how can you do MDS? Is for doing an MDS in India, you have 2 examinations. Okay, one is NEET. It occurs once a year, 1 time per year. And 97 to 98% of MDS seats in the country will be filled by NEET. Second one is INI-CET. It occurs 2 times per year. And it occupies that 1 to 2% or 2 to 3% of seats. Clear? So you're eligible to give NEET, you're eligible to give INI-CET. INI-CET occurs 2 times in a year. The one session is going to be in November. The second session is going to be in the May. And NEET, now it is a bit dynamic, but most probably it will be January. December, January or February. Clear? So these are the 2 gateways, 2 exams. Even if you're financially very strong, even you can be a son of a DCI president, or you can be a son of a dean or a college principal. Even then you have to write this exam and you have to qualify this exam. Without qualifying this exam, without writing this exam, you cannot buy a seat or you cannot get a seat. Is it clear? I hope this should be very, very clear. So NEET and INI-CET. So the next important thing is, okay, so the number of seats, okay, in India, we have around 6,000 MDS seats per year. Out of the 6,000 MDS seats, you have somewhere around 550 to 560 GDC seats are there. Government dental college seats are there. Okay. How many government dental college seats are there per year in India? 550 to 600 seats. Government dental college seats. What is the advantage of government dental college seats is, one is more OP. What is the other advantage, guys? You have more OP. More outpatient OPD will be there. And these are free seats. And they'll give you stipend. You have in and around like 8 to 10 central government colleges are there who are going to give a stipend of more than 80,000 per month. 8 colleges in the country are there, central government colleges, who are going to give stipend of more than 80,000 per month. And you have Maulana and you have Delhi University. These are going to give a stipend of 1,16,000 per month. 1,16,000 is a stipend for 2 colleges in the country, the first filled colleges. Is it clear? This is 1,16,000. 1,16,000 per month. So just you can calculate 1,16,000 into 12 months per year into 3 years. It's going to come around 41 lakhs. You will get 41 lakhs stipend in the form of stipend in your 3 years of PG. Clear? Clear? OPD is good advantage. You'll have more OP. You can learn more things. Now that is a free seat. No need to pay anything to the college. And every month they are going to give a stipend. Okay. The highest stipend is 1,16,000. And there are 8 colleges with more than 60,000 stipend. There are 12 colleges with more than 65,000 per month stipend. There are many colleges with more than 50,000 per month stipend. Clear? Can I move to the next part? I need your response in the chat box so that I can discuss more. I can make you more comfortable. I can make you more confident. And this is all information what you have to know before you start your proceedings, before you're planning to know about your future in dentistry or your future plans, right? Next, how many GDC seats are there per state? So here I want to tell you very important thing. So there is something called as All India 50%. All India 50%. What is this? For example, in a particular state, okay, for example, we have more Maharashtra students today. So in a particular state in Maharashtra, okay, you have total number of GDCs you have are somewhere around, okay, consider, I'm telling a rough figure. Okay, for example, we'll consider it as 100 GDC seats are there. So what you have to do? So Maharashtra government has to split this half GDCs and they have to give to All India. Means 50 GDC seats will be filled by All India and 50 seats will be filled by state pool of Maharashtra, state of Maharashtra, in Maharashtra State Council. So everyone is eligible to All India. So for example, this 50% seats, even a Madhya Pradesh student is also eligible. The Andhra student is also eligible. Telangana student is also eligible. Karnataka student is also eligible. Tamil Nadu, Kerala is also eligible. Whereas the leftover 50% is in the state pool, only Maharashtra students has to take. Similarly, like if you take your Telangana, you have GDC Hyderabad. So in GDC Hyderabad, if you have like somewhere around like consider it as 24 seats are there. So 12 will be for All India, 12 will be for state pool. Well, anyone can take. And this only state people can take. Clear? Is it clear? Right? Is it clear, guys? All India pool. How All India? So every state is going to give their 50% of seats from Jammu and Kashmir to that of the Kerala, Assam. Every state is going to pool. And this pool is called as All India pool. All India pool. So in All India pool, the cutoff ranks will be in and around like this. For an open category student, in an All India pool, the open category student will have a cutoff at 350 to 400 All India rank. If you get 350 or 400 below in All India, there are high chances that you will get a GDC of any department. 350 range will get a non-clinical. If you are 100 below, you will get a good clinical in a good college. 50 below, good clinical in central government college with more stipend. 20 below or 30 below, you will get Maulana with 1,60,000 stipend per month. This is how it's going to be. For an OBC candidate, it will be same around range of 400 to 450. OBC or EWS. OBC or EWS, you will have a range of 400 and 450. You will get an All India. Whereas for an SC student, 2,000 below. So let's not take let's not consider 2,000. I want you to keep 1,500 as a target. Okay. So for an SC student, you have to get All India 1,500 below to get a All India government college seat. And for an ST, you can keep a target of 2,000 or 2,500. 2,000. Let's make it as simply make it as good seat. Keep it as 2,000. Okay, 2,500. If you are PH, physically handicapped, so if they keep 1 or 2 seats for physically handicapped and you are the only one, you will get that seat. Is it clear? Guys, is it clear? Clear with the cutoffs. I want you to know the cutoffs. Then only you can keep the goals. Then only you can keep the targets. Then only you can work hard. Followed by once you are done with all India, okay, then you can apply to your own state. Maharashtra people can apply to the Maharashtra state. Telangana people can apply to the local Telangana. So all your colleges, like I think like most of you are from Nasik and all these Aurangabad and everything. So your college seats will be coming under state pool, not in all India pool. Is it clear? All India pool is only for government colleges and it will be only for few deemed colleges. If you are from DY Patil will be coming in all India pool deemed college. But for example, if you are from Nasik, if you are from ACPM, okay, or if you are from People's Dental College of Bhopal, okay, your college will be coming under state pool. Is it clear? You got a clarity, right? What is state pool? What is all India pool? What seats will be coming under all India pool? How many seats will be coming under all India pool? How many seats will be coming under state pool? Clear, right? Okay, this knowledge is very, very important because most of the people, they assume that even after getting 1,000, 2,000 rank also, they assume that they are getting GDC. They feel that they are going to get a government dental college seat. I was talking to few of such people and I was asking, who told you? Sir, there is one YouTube video I have seen, sir. Even if you get 1,200, 1,300, they're telling that you will get in a government dental college. No, that's not the reality. So come out to the reality. Come out, learn the reality, learn what is happening. Okay, once you learn what is happening, you can keep such tough goals. You can keep some tough goals and you try to achieve them. So for MP students, the GDC that is available for use is indoor. So indoor is going to have 3 seats in ortho. So 4 seats in prostho, 4 seats in oral surgery, 3 in perio, 3 in oral medicine, 3 pedo, 3 oral path, 3 public health, and 3 conservative dentistry. So here what is going to happen, how the splitting is going to happen. For example, oral surgery, 4 seats are there. So 2 will go for all India and 2 will go for the state pool. So you take conservative. Conservative has 3 seats. Cons has 3 seats. So what is going to happen? 2-1. So 1 year, they're going to take 2 seats for all India and keep 1 seat for the state pool. And the next year, they're going to keep 1 seat for all India and 2nd state for the state. Because 3 cannot be split into 1.5 and 1.5. What they do, 1 year they're going to give 2 and the next year they're going to give 1. Is it clear? 4, it is okay. Even number, it is okay. Odd number, one time they're going to give more 1 seat and second time they're going to reduce 1 seat less. Clear, clear, clear. So this is the only GDC that is available in MP. So checking out next, if you're talking about Hyderabad, so Telangana, again, you have 1 GDC. So you have 3 seats in every department. So 2 seats 1 year to all India and 1 seat for all India the next year. So this is how they're going to give. So oral surgery 3, conservative 3, pedo 3, oral path 3, public health 3. So if you're from Karnataka, you have again 1 GDC. The second GDCs have started, but PG is not yet started for all these GDCs. So there is only 1 government dental college, Bangalore, which is providing the MDS seats. So you have ortho 3, surgery 3, perio 3, medicine 3, public health 3, conservative 3, prostho 3, oral path 3, and pedo 3. And of course, the most waiting is Maharashtra. So what I can tell you is Maharashtra is having the highest number of GDCs colleges as well as GDC seats in the entire country. So you have GDC Mumbai, you have pedo 5, oral path 5, medicine 5, surgery are 10, prostho is 10, conservative is 5, ortho 5, and perio 5, followed by GDC Aurangabad. Okay, you have prostho 6, and rest all departments are 3. And you have GDC Nagpur, okay, where you have your perio 3, conservative 3, ortho 3, oral path 3, oral medicine 2, surgery 3, pedo 3, and Prostho 3. And GDC Nair, again, Mumbai, you have one more GDC, okay, where you have hell number of seats here. Prostho 5, oral medicine 5, oral pathology, sorry, Prostho 10, oral medicine 10, oral pathology 10, conservative 10, surgery 10, pedo 5, perio 5, and ortho 3. So these are the GDCs that are available in Maharashtra. Okay, so Maharashtra is having the highest number of GDCs in the entire country and more number of GDC seats also. Okay, so coming to the sequence of exams you are going to give. Okay, so probably the first exam that most of you are eligible is going to be November 2023 INI-CET. So this is the first exam that you are going to give. So how many days you have for this exam, guys? This is the first exam you are officially eligible. If you are preparing seriously for MDS, okay, keeping MDS as a target, the first exam you are going to be eligible for is November 2023 INI-CET. So how many days you have for this? Okay, so you have exactly 12 to 13 months for this examination. So I want everyone to be serious to the preparation. So keep this exam as a target. Okay, so number of seats will be in and around like 15 to 20. Okay, now recently AIIMS centers has increased, so the seats they are trying to increase. So previously we used to have very less in a single digit, but now they have moved to double digit. So the number of questions will be 200. Time duration is 3 hours, and it will be minus 1/3 negative marking for every right answer. If you are getting plus 1 mark, for every wrong answer you will get minus 1/3. And each question you have to handle in less than 50 seconds. And you will have diagram based questions. You will have more regular questions, and you have new pattern questions. What is new pattern questions means? Like, I hope you remember your UG level, like assertion reason based questions. Arrange the following in ascending order, descending order, true or false, match the following. All these are the new added questions in the latest 2 to 3 years. In the last 2 to 3 years they have. So most of your questions will be moving around clinicals. And in the clinicals also, you'll have more questions on endo, ortho, oral surgery, conservative, perio, pedo, prostho, implants, oral medicine, radiology, oral pathology, and general anatomy. So most of the diagram based questions will be from the clinicals. Okay, so this is a rough blueprint, not exact blueprint. Exact blueprint we are going to discuss as we proceed to the classes. And next, the second exam that most of you are eligible is going to be, first I said it is November 2023. So for that you have 13 months preparation time. So followed by the exam may be like prediction exam may be like in January. So after finishing November, so you'll have 30 or 40 days more. So maybe you'll have 14 to 15 months preparation time for your January 2024 NEET examination. So this NEET examination is going to contain all government dental college seats, all private college seats, all deemed college seats, all the seats available in every college, whatever college, wherever you're reading from. Okay. And this is eligibility criteria for your Army Corps also. Is there anyone who are planning for Army Corps, Army Dental Corps, or you want to know about Army Dental Corps? Okay, right. So Army Dental Corps, every year they are going to have some intakes of 35 to 40. 35 to 40 intake will be there for Army Dental Corps. So you can work as a dental officer or a dentist in an army background, with an army background in the army troops and everywhere. So you are going to get a rough stipend or rough salary of 90,000 to 1 lakh. And it's going to increase basing upon the experience, and you'll have a 13 years to 14 years service over there, after which you can come out and you can have your own practice or something. Okay. But for Army Corps, the first, you will have 2 rounds, round 1 and round 2. Round 1 is decided basing upon the NEET rank. And round 2 is going to be interview. Okay. As of now, the interviews are going for your super seniors. They are attending the interviews. So from the interviews have started from October 2nd week, and they are going to close by 15th or 16th of this month. So first is you should get a good NEET rank with which you are going to apply the form. And second, they are going to call you for an interview and a medical examination. Okay. Right. So, long back, we used to have a different rule, but now what they have done in the last, in this year is, So out of these 35 intakes, 35 to 40 intakes, so they kept only 3 intakes for women and more intakes for men. So if you have interest or fantasy towards army and everything, so the probability of clearing the part 1 is going to be easy for a male compared to female. So this bias was started this year, so we cannot do anything. Okay, I'm sorry for the women. Okay, so now they are taking less women. Okay, so women are just 3, and cutoff for the recent women was in and around like 22 all India rank. So you should get 222 all India rank. Okay, 222 all India rank to qualify as a woman, and males have qualifying up to 2000, 2200. Also, there are many people who has qualified for the round 2. So now they're going for the interview and the medical examination, followed by the final list is going to be out. So in that, the top 40 people are qualified to serve the country as the Army Dental Corps. Clear, right? So the rough idea I have given, right? Okay. So next one is the subjects. The questions are going to be 240, where your INI-CET, the questions are 200. Okay, right? And time duration is same. INI-CET is 3 hours. NEET is also 3 hours. And coming to the negative marking here it is -1/4. There the negative marking is -1/3. Here for every right answer you will get +4 marks, and for every wrong answer you will get -1 score. Okay, so there what is going to happen? There you are going to get every right answer you're going to get +1, and every wrong answer you're going to get -1/3. And for every question you have to solve in 40 seconds. 40 seconds. You have to finish every question, and diagram based questions are going to be 35 to 40 plus, and you will have lengthy case based questions. I'll expose you to all this different range of questions as we start the proceedings in the upcoming few days. Right? Clear, right? So clear with the basic blueprint of AIIMS, the basic blueprint of the NEET and everything. So once you're done with the NEET, again, I said what I said you are eligible to take May INI-CET. So INI-CET will be done in November, followed by after 6 months in May also, you'll have one more round of INI-CET. So if you're interested, you can take May INI-CET. May INI-CET will have more number of seats. Okay, seats will be more because it includes PGA also apart from AIIMS. It includes PGA and JIPMER. So the time duration, exam pattern, everything were same, which were discussed previously. So NEET, they have given a blueprint, and we people have given a blueprint that every subject is going to carry 14 marks. Your anatomy with embryology, histology is 14, physiology, biochemistry 14. So physio 7, biochemistry 7, dental anatomy, dental histology 7 plus 7, pathology micro 7 plus 7, pharmacology 14, dental materials 14, general medicine 14, general surgery 14, oral path 14, oral radiology 14, pedo preventive 14, ortho 14, perio 14, prosto 14, conservative 7, endo 7, maxillofacial 14, and public health 14. So anyway, I'll be sharing this blueprint to you. Just do make a note. Every subject has an equal weightage. That's what I'm telling. So there may be a cases where you are going to give more importance to few subjects, but logically your preparation should be a balanced, because every subject has an equal weightage in your NEET examination. And books to be followed if you are a student of MDS CONQUER. Okay, so I want everyone to carry the PP books. PP books are hard copies of books which are given to you as a hard copy. Okay, if you're a student of MDS CONQUER, this will be dispatched to your postal address. These are very, very unique books which helps in quick revision, which contains lots of diagrams, which contain lots of repeats, tables, all the memory-based content, which we have condensed to one book that is called as Power Play books. And I want every one of you to carry the latest edition of Dental Pulse. As of now, the 15th edition is available in the market. Probably after 4 or 5 months, they may come out with the 16th edition, but I don't want you to wait till that date because we are already running short of time. It's better you start the proceedings as early as possible. So I want you to take the 15th edition. And I want you to take the dentist clinical part. Dentist is going to have both clinical as well as non-clinicals. Okay. Non-clinicals, I'll be telling you what to be done and I'll be providing you the material in a different way. Okay. But I want clinical exposure should be more. So I want you to take dentist clinical part as well as Dental Pulse 15th edition. So both of these books you have to carry. PP books I'll be sending you as a hard copies. So all previous papers from 2017 to 2021 will be available on the website. So last year it is 2017 to 2021, but this year we are planned and we have increased it for your senior batch. So we will be giving you the same access. So now we have extended it from 2010 to 2021. So you'll have more MCQs that are available on the website. So all latest concepts available on the website, smart notes is available on the website, last minute stuff available on the website, mock exams available on the website. So textbook reading content, videos available on the website. So everything, the website is the best source. Okay, you'll have diagram-based questions, case-based questions, memory-based questions, numerical-based questions, subject-specific exams will be there. Okay, again, topic-specific means every subject is going to have 10 to 15 topics, and each topic you will have an exam. So you will have a big question bank on the website. Okay, so whenever you start, you can dig out and you can solve. Apart from the hard copies, what you have related to the Dental Pulse and dentist, okay, you'll have lots of questions on the website available as a question bank, as also available as an exam. Okay, so I want you to carry your well organized, a little bit of expensive notes, and I strongly recommend every one of you to use Classmate good quality notes, because whatever notes you are going to write, so they should be ease. They should have that ease and pleasantness when you're reading for them for the last time during the last 2 to 3 months of the phase of the preparation. So I want you to, this is my friendly suggestion for you. I want you to carry highlighters, pencils, stickers, stick notes, glitters, whatever that's going to make your preparation more colorful and make your preparation more interesting, because preparation is something like which you should have more attachment, more involvement. So you have to make it more colorful, more innovative, more attractive, so that you'll get addicted to the preparation. So if you are addicted to the preparation, then it is very, very easy for you to handle the stress, handle the situation, handle the time, and get a good rank. Guys, clear? Can I move to the next? Can I move to the next part? Yes. So what CONQUER is going to do? What is unique thing that MDS CONQUER has? Okay. So the unique thing that MDS CONQUER has is the smart work, which we are going to add. So students should have their basic hard work. And what we are going to do, we are going to add smartness to your preparation. And what the team of MDS CONQUER is doing from past 8 to 9 years is, okay, we are going to be in touch with the student. Whenever you feel like talking with us, we are available for us. We are not like a regular online app where you just registered, get the bank, get the material, you read by yourself, okay, or you see a video and read by yourself. So whenever you are low, whenever you have ups and downs in the preparation, because we are humans, I strongly believe we will have lots of up and downs in the preparation, lots of up and downs emotionally when you're an intern. Okay, so what we are going to do, we are going to be in touch with you. So if you feel like talking with us, we will be available for you in maximum 24 hours or 48 hours. We'll be responding you, we'll be talking with you, we'll be having an interaction with you. And there are many other cases where I traveled long distance and I have reached so many places. Okay, so I was there in Bhopal, I was there in many other places. So I constantly move from college to college so that we can interact with each other, we can talk with each other. So most of the problems and most of the solutions for most of the problems is by talking. So if you talk with someone who is experienced, someone who has a vast knowledge over this, some good resource person, you can come out of the problem. And that is what required. The emotional support for preparation is very, very required. And that will be provided by the team MDS CONQUER, apart from the stuff what we are going to provide you. So we're going to provide you hard copies. It's not an app-based preparation. I don't encourage an app-based preparation. Okay, it's a mentor guidance-based preparation that can occur through an app or that can occur through a website. Sources, app and website, but the guidance will be the individual. So every morning you will get a voice note where we are going to interact, where we are going to talk, and where we are going to tell you what to be done for this particular day. For example, it's a weekend. What to be done on a weekend? Weekend, you do a different job. Normally, you do a different job. Or it's going to be a festival day, Diwali. Diwali is a common festival for everyone. So I don't keep schedule on Diwali. I don't keep schedule on the major festivals. I don't keep schedule on Christmas. I don't keep schedule when we have a new year, because we enjoy that phase, right? So it's like an emotional based guidance. So every day the team is going to help you out, and whenever you want, we are going to reach you out and we are going to interact with you. And how to start the preparation is the biggest question that most of us have. You know, rule of 21? Any idea about rule of 21? Yes, anything requires rule of 21. Constant hard work of 21 days. A first 21 days is a winning thing for your preparation. I have seen this in more than 60% of the students in my 13,000 of students whom I have trained till the date. So in the 13,000 students, my analysis were more than 60% of the students, they are successful by following rule of 21, because most of the students, they quit the preparation in the 21 days. But if you cross the 21 days with all the pain, all the energy levels, building your confidence, definitely out of these people who are crossing 21 days, 60% they end up with some extraordinary and great ranks. So it's all about falling under rule of 21. It's something like falling from bicycle. So on the first day, every one of you, including you, me, everyone, we are not able to balance the situation. We are not able to balance the bicycle. But on a process, we have learned it. So I want every one of you to hit that constant practice. Every day you should have that enthusiasm that, okay, Ness, I have to be serious about preparation. I have to be focused on the preparation. You keep your goals. Okay. Don't talk about reasons like I'm not feeling good, so I have not done it. My mother is not feeling good. The OP in the college is too heavy. I was posted in conservative department. I was tired. So these reasons, you should not give any sort of these reasons for the first 21 days. You organize the things. I'll help you in organizing the things. I'll tell you what to be done, where to be done, how to be done, and how to handle it, how to easily finish it. I'll be helping you out. But time adjustment, time management as an intern is going to be the biggest challenge that every one of us to focus. So time management, how an intern has to manage time, how interns are able to get good ranks, extraordinary ranks. The only reason is they sacrifice few things. Gossips, talkings, department, whenever we free, we interns, as an interns, I still remember my internship 10 years back, we used to gossip more on others. So stay away from gossip, stay away from social media, stay away from nonsense, stay away from unnecessary things. If you focus on, you will get time. Interns are not able to have time is just an illusion. If you are able to remove that illusion and apply 21-day rule, things are going to be easily possible. And I'm going to help you out. Don't worry, I'm going to help you out in this 21 rule. And I'm going to keep on motivating you at different levels in different modes. Which course is most effective with high percentage? It is more interactive course. I strongly believe ProLive is going to be more interactive because you are going to meet mentor every week, 2 times you are going to meet the mentors. Okay. So whenever you meet the mentor, there are high chances that you are going to. The only difference between the ProLive and a Plan A is ProLive is going to have live classes. And the live classes will be evening from 6 o'clock to 8 o'clock. The ProLive classes will be evening from 6 o'clock to 8 o'clock. Okay. Even if you miss the ProLive class, I strongly recommend ProLive should be live. Even if you miss the live class, the recorded version will be available for reference, for revision and everything. We are going to provide you access to the recorded version also. So as already discussed, Plan A have many things. You can access Plan A anywhere from any time throughout the globe. Any times you can access it. The syllabus will be covering the syllabus twice. Okay, and you'll have one-to-one analysis after every grand exam. You'll have smart notes from the standard textbooks. You'll have PP books, hard copies. You'll have access to more than 1,500 videos. You'll have diagram-based discussions on videos, case-based discussions. You'll have latest question papers discussions. You'll have daily WhatsApp activity you're going to have. You'll have 500 plus topic-specific exams, 50 plus subject-specific exams, 50 plus diagram-based exams, 50 plus case-based exams. You'll have rapid fires, 24 into support by the mentors. Mentors are going to respond maximum within 1 day, or sometimes it can be 2 days. You'll have doubts day. Whenever you want, you can post the doubt. The mentors are going to help you out. And you'll have constant interaction with the All India toppers, either in the Zoom or either in the live class or either in the Instagram or somewhere. And we are going to provide you the proper counseling and suggestion, because nowadays, most of the coaching centers, they're not providing a proper guidance for the counseling and option filling and everything. Again, you have to find a mentor. Again, you have to pay. So in this course, as of now in the early bird, so we are including the counseling suggestions and guidance also till you enter the college, as an MDS and with an MDS tag after getting a good rank. The team is going to help you out. I think offline as of now, okay, offline, I think it's not going to be possible for an intern. So offline is going to, we're going to provide plan A, and apart from that, all the additional features will be there. So you'll have live classes and syllabus will be covered twice. You have AC study room and library access 24/7. And you will have you'll have smart notes from standard textbooks, library access 24/7. One-to-one analysis after every exam will be there. Okay. You'll have more number of classes, more number of interactions, motivations, personal guidance, and everything in the offline centers. So these are the offline centers. And of course, we are going to provide you the coaching for INBD, as already discussed. INBD is for USA examination. So we are going to provide you the coaching for INBD also. And we have recently started the bench test 14 days course also. Okay, if you have any plans of going for USA or anything, so we are open. So in India, we don't have proper guidance for the bench test, but we have planned a 14 days basic bench test program. For that, you need to come to Hyderabad. Normal theory, INBD theory, you can prepare online. No need to come to Hyderabad. As an intern, you can prepare to. But INBD 14 days bench test course, you have to take off from the college and you have to come to Hyderabad to finish it. And I strongly recommend people who are planning to USA. Okay, so I want you to finish this INBD 14 days bench test course as fast as possible. So that, because as you have more number of patients, by learning the things here like microscopes, maybe rotary endo, you're going to learn here, microscopes you're going to learn here, rubber dam isolations you are going to learn here, you're going to learn perfect class 2s, inlays, onlays, crown cuttings, everything whatnot related to INBD, you're going to learn everything. So you will have a vast time throughout your internship. When you're posted in prosto, you can plan your crown cuttings. You're posted in endo, you can plan your class 2 inlays, onlays. You're posted in endo, you're going to plan your operative. Pedo, you're going to do something. Isolation, you can do everything. You can practice it so that you'll be well versed with the clinical skills also. So you can consider that as a clinical course also, right? So this is our academy where you're going to have your all the latest equipment, all the latest things that are going around the globe in the dentistry. You'll have magnification, you'll have microscopes, you'll have all high-end instruments, you have laser-based dentistry, you have everything, and you can come and you can learn as a part of your upgrading aspect. Okay, so coming to the achievements of MDS CONQUER, MDS CONQUER is standing, getting single digits from many years. And of course, most of our single digits are interns. You can see last year we got All India 8th rank. She's an intern. And before that, we have a student from Assam who got single digit. Then we have Somya, who got All India 2nd rank. Then we have Bharati, who got All India 3rd rank. So all these are interns. So we have like an interns. Yes, of course, time is not a big factor if you are focused and if you have a proper guidance, and our students has proved it at the best. So recently we have made Maharashtra state first, All India 22, and we have made Assam state 2nd. Okay, and followed by, of course, we are standing first in Telangana and Andhra from past 6 years. Okay, and of course, and the same prospect, the reason why I'm keeping all these achievements is the last year All India 8th ranker Shweta, Telangana state first, is an intern. Navya, Andhra state first ranker, and All India 28th ranker is an intern. Pooja Jain last year is an intern. Haripriya is an intern. Chandana is an intern, and Somya is an intern. So all are interns. Achieve more. We have more because ours is like more inclined to the online. Offline, we have students. Repeaters are going to come for the offline center, but more of an interns. They pick MDS CONQUER, and we have an extraordinary result with the interns in the last couple of years. And of course, the repeaters are also do good, but what I strongly believe is whenever you have a direct intimacy with the mentor, that's going to create more impact. And most of these students are pro-live students. So interaction with the mentor is very, very important. That can occur through pro-live or that can occur to offline. So it's not going to be possible for an intern to reach an offline center. Okay, unless you stay within Hyderabad, Okay, of course, as an interns, you can come to offline center, but most of the interns, they cannot reach the offline center if you stay far away. So we have students from JK. So the online access is going to be easy. So basing upon your convenience and everything, you can plan accordingly, or after finishing your internship, you can come to the offline center for the last 2 to 3 months crash course or something. So this is my all-time contact number. So your helpline or lifeline number, you can call me, interact with our team, talk with us, and plan accordingly and everything. Okay, so I'm done from my side here. Okay, so there are many other things which I need to discuss, like non-dental options after BDS are also there. So when time permits, I'll take the class regarding that. But if you have any doubts, you can drop it on the chat box so that I'm ready to help you out. If you have any doubts, you're open. I mean, there may be lots of confusions and everything throughout the process of preparation. That's okay. I'll be there to help you out. But as of now, before you start the proceedings, you have any doubts regarding the approach, regarding the goal, regarding the plans, or regarding MDS CONQUER, you're open to drop on the chat box. So I'm ready to answer all those questions. I strongly recommend KNR students to start the preparation as early as possible without wasting any time, because your seniors are suffering. Your seniors are suffering, so I don't want you to suffer. So that's what, as of now, I told you, right? So no, we are not going to provide. I'm not taking admissions as of now for ORE. Okay, because most of these abroad options, they have time limitation. So you should be ready and prepared to spend more time. 5 years, minimum 5 years. They're going to take, they starts from 3 years to 5 years. So first of all, you should be financially strong. Second thing, you should be, you should give the time space. Okay, when you give the time space only, the things are going to work out. Yeah, first of all, you can start with the dental pulse. Then after a few days, if you want, you can add dentist clinical part. Rest everything I'm going to provide you. So I want you to have a good quality of material that most of the toppers of all India are doing. So most of the toppers of all India, they do dental pulse and they do dentist. Okay, these are the 2 books. Apart from that, the precise material I'm going to provide you in a different source so that we can take away our preparation. No, you check out the possibilities of ORE. ORE is good, but you check out the possibilities, how you can go there, how you can slot. ORE slots are not available now. Waiting period for ORE is more. So you have to start working from the day 1 of internship. That's what I'm telling. Planning is very important. You check out now. As of now, there are 2 or 3 of my juniors and batchmates who are in UK, but they are not able to get that slots. Slots are not patient station slots are not available. So they have to wait for the slots. Pradeep, I'll be telling you how to start and everything. We'll be having a videos. We'll be having one more session. So I'll be telling you in that how to start and how to proceed ahead. Don't worry about that. Preparation part, you can leave it to me. You can. I'll make sure that I'll sail you to the safest zone. I'll give my 100%. So this is what I'm doing from past 8 to 9 years along with my team. So I'll be available for you all the time. So we'll be interacting. So that's not a big deal. That's not a problem. I'll help you out. Don't worry. Offline center will take some time here. Okay. Maybe probably if you are ready, I'm ready to start. I feel like Telangana people are a bit lazy. Okay. Okay. I need to motivate them, encourage them. It's going to take some time. So if you are ready, if you guys are ready, then we can start, or else we'll be starting after finishing your final year exams. Meanwhile, you can start your proceedings in the online. INBD is a lengthy thing. Maybe probably we'll take some in this week. We'll keep one more session to discuss about INBD. Is it okay? INBD will take 1 hour time to talk about the steps of INBD or anything if you want in specific. Either you have to book a slot of mine, okay, or if 50 people or 100 people are coming, then it's okay. Then I'll come online and then I'll discuss. If 50 people, minimum 50 people should be there for my session. I'll announce. We can plan INBD. INBD will have lots of people. Anything more? It definitely, I mean, the mode of content in offline and online will be same, Navya. Content wise, you don't have much difference in online and offline. We teach the same content. But when you're talking to offline, the mentor will be with you. The mentor will be with you. The impact will be more. When I'm talking online, the impact will be different. When I'm talking live, the impact will be different. When I'm posted a recorded video, so probably I'll be posting this as a recorded video on YouTube. You watch a recorded video on YouTube, that impact is different. When you're talking live, I'm talking directly to Navya now. That impact is different. So pro live is different. And when you're talking live, your mentor is sitting in front of you, talking with you personally. That impact will be there. When you have chance to offline, I strongly believe repeaters has to come to offline. The impact will be more. Online course is online course. Offline course is offline course. Everything has its own impact. Like that's what I'm telling. Comfort zone is online. Break the comforts and come out is going to be offline. So when you break the comforts, chances of success will be definitely more. That's what I'm telling. NASIC student cannot travel over every day, every week to Hyderabad to hear the classes. So NASIC student has to go for online. But in the last 2 to 3 months, if they have chance, they can come to offline center. And we are here to provide you the backup support and everything. Like we love to help you. And we are doing this from past 8 to 9 years. That's what our job is. PP books, we are thinking of to do some modifications. Like we'll let you know. If you want, old edition is already ready. So we are just, the team is just thinking of whether to send the old edition or the new edition. Maybe I'll update you in the next 1 week. For the people who are already done with the payments and who have already started the proceedings. Done, guys. Yes, offline course will have access to Plan A. You'll have access to Plan A. You'll have that 1500 videos access. Yes, online student will also get PP books. Online student will be sending the PP books by the postal. That's what I'm telling. Compared to many other institutes, very few institutes, online institutes are going to provide you hard copies. We are going to provide you hard copies. Hard copies will be sent to your postal address. Any more doubts, or shall we close the session for now? Your seniors are waiting for a class. So we have one more class at 8. I thought of finishing it by 8. It's almost like 8:05 or 8:10. So seniors are waiting for the class. So we need to proceed with that. So if you have any doubts, you can ping me on the WhatsApp. You can call me. We can have a talk and everything. And of course, and most of you know that we have a bulk offers also. If more students are planning to join from a particular college, okay, we will provide you bulk offers. And if more than 20-25 students are joining from a college, I'll definitely give a commitment that I'm going to come once or twice a year to meet you in person. I will be coming there, staying in your college or around your college for 1 day and spending a quality of time in encouraging you, talking with you, and giving you some motivation. Chalo, shall we close for now? Okay, done, guys. Bye. Take care. Bye-bye.